Hello, I'm Christine Moffa, the Interim Editor-in-Chief and Senior Clinical Editor of the American Journal of Nursing. You're listening to a podcast in our Behind the Article series, where we interview authors of articles appearing in the journal. You can find all of our podcasts on website ajnonline.com under the Multimedia tab, as well as on iTunes, Spotify, and Google. AJN's content, including all the article we refer to in this podcast, is accessible online on our website, ajnonline.com. You can also find AJN on Facebook, Twitter, LinkedIn, and our blog, AJN Off the Charts. Today, I'm delighted to be speaking with Dr. Alexa Colgrove Curtis, who is Assistant Dean of Graduate Nursing and Director of the MPH-DNP Dual Degree Program at the University of San Francisco School of Nursing and Health Professions. She's the lead author of the 10th article in the series, Nursing Research Step by Step, produced in collaboration with the Heilbrunn Family Center for Research Nursing at Rockefeller University in New York City. The series is designed to give clinical nurses the knowledge and skills they need to evaluate and participate in research step by step. Each column presents a different research concept or method, from research design to data interpretation. The column appears every other month in AJN. This month's installment builds on a previous article in the series on measurement in nursing research and reviews the use of diagnostic studies in nursing research and clinical practice. So Alexa, welcome and thanks for taking the time to chat about the article.
Thank you, Christine. It's a delight to be here with you today.
So nurses are familiar with using screening and diagnostic tests in patient care. We use them at the bedside. We use them in doctors' offices, etc. But how are they used in research?
So in research, we use a diagnostic measure to provide an outcome measurement for the variable of the research that we're doing. So if we want to say, if we're researching, say, let's say stress, a diagnostic tool might be a survey that evaluates stress. Or if we're researching an outcome that relates to blood glucose, we might use a point of care finger stick glucometer as our outcome measure for the research protocol.
And how do researchers decide which test to use when designing a study?
So it really depends on the variables that the researcher is studying, certainly. It depends on the study design, how the study is being conducted. And then there are more practical considerations, such as the practice standards within the environment that the researcher is working in, the cost of the diagnostic measure, the acceptability of the measure to the participant in the study or the patient, and then perhaps even the accessibility. Is it a diagnostic tool that is readily accessible to the nurse researcher, or something that is prohibitively expensive or hard to obtain?
And then the article goes into an explanation of diagnostic research. So can you tell our listeners a little bit about that?
Yeah, that's a really interesting area of research that I think a lot of us don't often consider. We think of our diagnostic tools and we use them and we apply them in clinical practice and we apply them in research, sometimes without giving a whole lot of thought to how they were developed. So diagnostic research is a field of research that evaluates the effectiveness of these diagnostic tools in identifying disease states or other patient outcomes.
And in thinking about planning a study, what do nurses need to keep in mind when planning a study on using diagnostic tools, or even if they're reading a study that uses diagnostic tools? What are some considerations?
Yeah, and I will include in that using these diagnostic tools in clinical practice. The considerations are often the same. knowing, well, I would even start with the acceptability of the diagnostic tool and the cost to the patient and the clinical practice and practice standards. I would always, as a practicing clinician and a researcher, start there. And then once I have an understanding of that, go into what kind of confidence does the clinician and the researcher have in the diagnostic tool to be measuring what we think we are measuring. So some concepts to be looking for when you're reading research, when you're considering the choice of a diagnostic tool, is what is the sensitivity of the tool. So the sensitivity is the ability of the diagnostic tool to rule in a particular state, and the specificity. So conversely, to rule out a particular variable of interest that you're looking at. And also, that's a couple other concepts that are important to point out that are in the article. The positive predictive value. So what is the probability that someone actually has we'll say, disease state if the test is positive? And the negative predictive value, what is the probability that they don't have the disease state if the test is negative? And then looking at further look into the reliability of the instrument. How consistent is the instrument in getting the same measurement?
Okay. And then there's also a discussion on biases that are associated with this type of research.
Well, yeah, and anytime that we're looking at research, we're always looking for what kind of biases, might emerge from the research that we're doing, trying to avoid our biases. So 3 biases are outlined in the article. One is called spectrum bias, where the study participants are not fully representative of the entire population that we're studying. So perchance we're using only the very sick or the very well in our studies. Another is verification bias, where we're only using a subset of the population when examining the diagnostic test and the reference test. So, for example, this can occur when participants who initially screen say negative for a test refuse to have a follow-up test with what we call the gold standard to confirm the results. And the last one is what's called incorporation bias, is when the reference test or the test that we're using it's not independent of the screening test. So the example used in the paper is, if someone screens positive, let's say for a positive COVID test, then if they are looking at the gold standard test, which perhaps the CT of the lungs, to see if there are changes, you might be biased if you already know that the patient has screened positive for a COVID test. You might already be looking for pathology in the lungs.
Okay, very good. Well, thank you very much. It was really nice to speak to you about this. And, the readers just love this series, and we're so thankful to have this at AJN. Research is something that a lot of people can be intimidated by. And so it's really nice to have everything spelled out for us and the way you and your co-authors do in this particular series.
Well, thank you. It's been a pleasure working on this series, and I know all the authors are very excited about being able to contribute to furthering nursing research, particularly among practicing clinicians.
And we look forward to speaking to you about the next installment. Thank you. Have a great day.
Thank you.